In past videos, we have spoken to you guys about facing objections, that you will face objections. You will be facing people that are not wanting your services. But most of the time is the first response from them is just a complaint, and you just need to be able to commit yourself to dive into further. But a lot of people, the moment that they receive objections, the moment that they receive a negative feedback, they ultimately retract and decide not to come back and go ahead and create reasons why they should not keep on going back to that potential referral source. Look, objections can take place in a lot of different places as a home health marketer or as a person. When you are trying to be able to get those appointments with those decision makers, when you're trying to create a presentation and present something to them, you may get objections when you are in the negotiation phase and the presentation phase. And also, of course, you're going to get objections when you are trying to close for those referrals. When you're trying to close the deal to get those referrals from those potential referral sources, from those physicians. You are always going to feel weak and fearful of being overwhelmed with these objections. Look, it happens to me until now. I get the fear. I get the feeling of weakness of getting objected upon. Nobody likes to be rejected. Look, there is no such thing as a person who is not scared of being rejected. But it is okay to do it. Look, if you're ready for it, if you are actually practicing, you're drilling, you're rehearsing, you're getting yourself ready, this should be something you prepare for constantly, okay? So when you do this, when you prepare yourself, you will be ready for any objections. How do you do this? Well, one thing is we're going to give you guys ideas on the most common objections that you're going to be facing, because that's how it is. We've already faced it. I've faced it. I'm still facing it until now. Okay, so you want to be able to make a list of every objection, and you want to be able to ready for that. Okay, so make a list of every objection that you hear, so that you are aware of what you may hear in the future, and then I want you to be able to practice how to handle them, how to be able to handle them professionally, and to handle them correctly. Look, our closing for referral section, our closing for referral training program, like we're sharing with you some information right now about this, but we have a full course on learning how to close properly, to close for referrals. It is one of the best resources that I can ever suggest to anybody, because we have hundreds and hundreds of potential objections that you're going to be facing. And at the same time as we're going to be giving you guys the techniques on how to be able to overcome those objections. Look, you're going to hear it all from those time closes where I'm not ready, or the person says I don't have time to talk to you, or a person tells you we don't have the funds to pay for the services for mom, or they'll give you so many different objections and complaints, but ultimately you know that they have patients, you know that their mom needs services. You need to be able to go past those objections and be able to realize that, look, people don't like change. And when people have to start using a new service like yours, it's not the fact that they don't need it, it's the fact that they're scared of changing their routine. And you need to be able to realize that. Look, people fear change. It's one of the biggest fears we have. We fear changing because we're already settled with what's going on around us. You know, that is why patients sometimes are reluctant to want to have a caregiver, because they always didn't need help. They always never needed help. So because of that, all of a sudden now that they have to succumb and actually allow somebody to come into their homes and care for them, it is a big change for them. And by us being ready for these objections and being understanding that sometimes it's not that they don't want our services, it's just that they don't fully understand it. So I want you to be ready to face all these different objections. And if you heard it once and you practice, drill, and rehearse it, you're going to know how to respond every time it comes about. So, you need to have one of those little black books where every time you hear one of those new objections that you've never heard before, write it down. You should have a black book in your back pocket all the time, because you need to be able to be ready to always go back into it and to see what you need to do to be able to actually handle it. And so our videos that we have, if you are using our closing guide, our closing for referral guide, you can easily access those videos and be able to know how to respond if you don't remember things. That is why we're here. We're trying to make things easier for you. Why would I want to just write it down in a piece of book and it's harder for you to find when I can put everything in videos and make sure it's in the palm of your hand or it's in your computer when you face certain things? Look, I want you to be able to learn how to handle these things. Let me give you an example. Let's say, for example, somebody's son is trying to find a caregiving company to start, to refer their grandma to or to refer their mother to. So, once you're done with your presentation, they may all of a sudden say this, well, you know what, I need to talk to my spouse first, or I need to talk to my mom first. So what would you say with this type of situation? And there's a variety of different ways on how to be able to answer this. And so let me go ahead and give you an example of what I would do if this ever happens, if I'm trying to present my non-medical care services to somebody and they give me what we call the objection called, I need to talk to my spouse, or I need to talk to my partner, or I need to talk to, my director of nursing, or anything that they make excuses where they want to ask somebody else. Look, the way to respond is like this. I understand. So the first thing you're going to say is, I understand. Or you can say, I agree. Remember, from my previous training, I tell people you always agree. Okay? Always agree. So you say, I understand. But if your marriage is anything like my parents, okay, that means your spouse knows that you are here. And you already agreed to discuss this with her. And you guys already agreed to make sure that your mom is going to be taken care of. If that's the case, that's why we're here. What can I solve? What can I give you guys? What can I offer you guys right now to make sure that we can take great care of your mom? Because the longer we wait, the longer that your mom's not going to be cared for. So here's the information right here. Let's start this today. Let's make sure we take care of your mom. And then you can make a decision later on what else you need to do if you need a different services. But I will guarantee you that our services are what your parents needs. Look, you need to be able to be there. They already asked you to do a presentation to them. So why are you going to then present and leave? Okay? You want to be able to be there and close the deal. You need to be able to know how to respond. The person who's not trained will say, okay, well, talk to your spouse, talk to your wife, and I will send you the sheets, the information, or I'll leave this here, and I'll give you a call. Now, what happens there is this. If you're bad at following up, that person is going to end up in another caregiving company because you let them away. You let them go from you. You already had them in your grasps. Look, you need to be an ethical marketer. You're there because you want to make sure you provide great care. So there's nothing wrong for you to pressure a little bit to get them to use your services because ultimately you know your services are great services. So don't leave their side. Never ever leave their side. Make sure you're able to get them. I agree that you need to speak to your spouse, and that is great. One thing we need to agree upon is that your mom needs caregiving services. So let's go ahead and start your mom with the caregiving services, because I'm sure that if your relationship with your wife is like how my parents have a relationship, then ultimately she knows that you're here and she knows that your mom needs services. So ultimately, let's get this started with. Let's take care of your mom because that's what we're here for ultimately. And then we can discuss later on what else we can do to provide for her. Look, you have to create these solutions. You have to have these scripts already planned. You must be able to know what you're going to respond with, okay? The purpose of this is to be prepared. The person who's prepared is the one that's going to be able to win in this business. So know how to be able to close those deals. Look, if a physician tells you, you know what, I have to talk to my manager or, my admissions coordinator in order to be able to make this decision. Look, I agree that you need to speak to them. Now, I am sure that you and your team respects you. And because of that, I'm sure that they know that you want the best care for your patients. Look, we're offering the best services out here. we're definitely going to be able to make sure we take care of your clients. I'm here in front of you right now. Let's go ahead and start taking care of your patients, because I know that's your ultimate goal, because that's why we're here for. Now tell me, are there any agencies out there that can offer the services that we're offering? Guarantee you, because remember, we talked about adding products that other agencies don't have, then he's not going to be able to say there is. Right? You want to be able to be positive, be a person that knows they have great service, and present that. Why are you going to leave and let them go to another agency? And what the funny thing about this is this. There's a study that's made that if I do a presentation and I do such a great job and then I can't close, if I give them that space, the next person that shows up between me, between the meeting, right after my meeting, potentially will get that referral. So you don't want to do that. You're there, you're in front of them, state what your purpose is. Your purpose is to get the patients, to get the referrals, and take great care of the client. So be able to know what to expect and know the objections you're going to face, and that's going to be able to prepare yourself. I have over 100 different objections that I've spaced already, that I've seen, and I've created scripts on how to be able to answer each one of those objections and be prepared for that. And we made videos for that so that you're ready for it, because that's how we do things here. That's how we prepare people. If you experience getting overwhelmed by the prospect's problems, situations, and objections, it is because you are not preparing yourself or your team on how to close things right. Look, be prepared. That's what Home Health Success Academy is here for, is to help you be prepared, help you as a marketer, help you as an administrator, train your marketers. You need to be able to help each other become successful. And one of the biggest things you need to learn is you need to be ready and trained for possible objections that you're going to face out there trying to get your business, trying to get those referrals. So if you want help with learning how to go past the objections that potential referral sources are giving you and is giving you and will be giving you, give us a call here at Home Health Success Academy. Our team of consultants will be glad. I'll be happy to help you become successful. Remember, home health marketing is not hard if you know what you're doing. That is what Home Health Success Academy is here for, to guide you. Would you like us to guide you? Would you like the success that you're going to be able to get with Home Health Success Academy? That is our goal. Let us help you. Give us a call so we can get you started with our closing for referral programs, with our full home health marketing training programs, being able to help you with your presentation. We have so many different ways. And don't forget, we have our virtual marketing team where we can actually be your marketing manager to really help your company become successful. Look, you want somebody that's going to push you. The people out there, the most successful companies, the most successful CEOs, they have their own coaches, because even the successful people need somebody to be their cheer squad, to somebody that's going to keep them accountable to being able to create products, to be able to be great managers. Give us a call here at Home Health Success Academy. We look forward to joining with your company and helping you become successful.